virtual healthcare conference. I'm just amazed how many things are going on. So can I thank all the people who've been involved in setting it up, particularly Raj, who's been organizing things, and Sunny in the background. So thank you all very much indeed. So I understand we've got a very wide people who are participating today, from children in adults in school wanting to come into medicine, to doctors and young doctors and so on. So what I'm really going to do is really what's on my slide at the moment. I'm going to talk a little bit about what it's like to be a doctor, what's going on around the world. I'm going to talk a little bit about problems that can happen, when you are a doctor, in terms of mental health, and then also what being a doctor is all about. So these are all shown on here, and Vicky's just mentioned the book. Thank you, Vicky. Clinical Medicine, which is just now coming out in its 10th edition. So just going on to talk about the profession, the world is changing and the profession is changing. And in the olden days, a doctor came to his patient and really was full of compassion, empathy, and altruism. But now we are in a world of advancing technology. We've got genomics, we've now got the genome, and I take part in the 100,000 Genome Project, which is just amazing. We can get back to the patients and tell them what's wrong for the next generation. And of course, artificial intelligence, AI, is also taking place. And Cyril Chandler, about 20 years ago, said medicine used to be simple, ineffective, and relatively safe. We had nothing to do. We couldn't do anything but hold your hand. But now it is complex, effective, and potentially dangerous. And Cyril wrote this in a Lancet editorial in 1999. But the consequences of this are that doctors have a greater capacity to do good, but their capacity to do harm is greater than ever. So we've got to be really careful and make sure that we train the doctors in the right way. There's always help around, and never be frightened to ask. But it's obviously a lot more to learn. So we're living in a changing world, and at the moment, as said, Burns just told you, in the throes of a pandemic. And if you go on a bit, I'll come back to the pandemic. Diseases are changing. When I was a little girl, if you had a heart attack, we'd put you into bed for ages, and lifestyle, and then maybe don't go back to work for 3 months. Now we just get you in, put in as a stent, give you some life-changing support, and all as well. And of course, with modern technology now, I'm sure we can now reach people far away without having to see them. We can monitor them. We can monitor your blood sugar on a little instrument. So all sorts of things can happen from afar. The population dynamics are also changing, particularly getting older, as Ed Burns just told us about. And the way we practice medicine is different. We're much more in a team. So it's a group of us working together rather than just individually. And education, as you will be here, is also changing. So really, what will the role of the doctor be? And I just hope that we will keep that altruism and compassion really with the patients, with all the modern technology. But I just hope in this utilitarian world, we don't go away from that compassion that we show our patients at the moment. So let's just look at the pandemic. Now, it's amazing, isn't it, that, the last 100 years, we've had lots of pandemics, but every time a pandemic takes us by surprise. And we've had some horrible ones. For example, in 1918 to 20, we had the Spanish flu. 25, that's 1 in 4 of the population was affected, and many, many, many deaths. And this has gone on right the way through. And you've noticed that they've got names of Spanish flu, Asian flu, Hong Kong's flu. Most of them are where this, and MERS, which is the Middle Eastern respiratory syndrome. So they have names, but the Spanish flu, I think, was really not because it was in Spain. It started in New York, but because there was a world war going on, people didn't want to say what was happening in case of morale. But of course, Spain was neutral, so it could actually say what was going on. So it became called Spanish flu. So but then we had Ebola, and the reason for me putting it there is that we managed to contain it. So it was contained in Guinea, Liberia, and Sierra Leone, and there were only 37 cases outside that, 36 cases outside that. So we somehow managed to contain that. But with SARS, which is at the bottom here, we haven't managed to contain it. So far, we've already got more than 600,000 deaths, and the cases are mounting millions, 15.5 million already. But what has really come out in there is the wonderful teamwork in dealing with this pandemic. We weren't ready for it. We've now hopefully got the right things in space. But the lovely thing was nurses, doctors, healthcare workers, porters, medical students joined in, and anybody who could help in the community joined in. And it was just absolutely brilliant how we can all get together as a profession. So population health, Ed mentioned the age. So by in another few years, 2025, there are going to be about a third of us who are already obese or overweight. And we really got something to do with this. And the government has just put out a notice today about, I hope, the 9 p.m. Shed of showing things on TV because children, of course, take it all from there. The genetic profile, we are now managing to work that out. Things we can change, a lifestyle. Alcohol has caused a huge amount of problems. People get onto cirrhosis and come in, and it takes a lot of money to look after them. Smoking, wonderful already. We've got a reduced number of heart attacks, chest problems by stopping smoking in public, and I hope nobody smokes in this audience. Obesity we talked about, and please do exercise because that has shown very good effects on the general population. Environment, the pollution, that's interesting. As you all gathered, when we had the lockdown, the pollution just fell. And you could see some world maps from outside space looking back at the world, saying how clear it was now with pollution less. Poverty, yes, we can do something about that, but unfortunately, this is also in lower middle income countries. And unfortunately, it's always wars that then reduce everything that's been happening for the good, and we're back in poverty. And of course, the effectiveness of the health service is very important in every country. So the current challenge facing us at the moment are really many. First of all, is the pandemic going on with COVID, SARS-2 as we call it. Second is obesity, and of course you get comorbidity with that, and diabetes mellitus type 2, that's the one you diet on without insulin, is increasing, and the numbers are amazingly high. Antimicrobial resistance now seems to have lost a little bit of its prominence at the moment because of the COVID epidemic, but we are now getting resistant to really all the drugs we've got, and some of the antibiotics we haven't got a new class for the last 30-40 years, so we really desperately need a new antibiotic to sort of to combat disease. Otherwise we'll be back in the Victorian ages where if you got pneumonia you died. Then climate change, and as you can see on this graph on the right, over 100 years you can see how it's just rising, and along with climate change, I just show you get a lot of other problems, and of course diseases start increasing with climate change. And then of course wars, displacements, we've had the refugee crisis. And can I just remind everybody, in these crises and displacement, it's the women and children who do the worst. Women get raped and used and sold for sex, and children likewise have nowhere to go. So looking back at the climate change, this is a map of poor countries, well, all the countries, but the ones in red are the ones who fare badly, and as you can see, they're the ones certainly here in Africa who do the worst. And this is the degree, the colors here are modeled on the changes in the grain, cereal grain yields. So the more hot you get, the less grain you're going to produce, and therefore starvation is high on the list. But apart from that, as we've all seen with climate change, you've got storms, you've got floods, you've got fire damage, you've got droughts. We've had the most strange weather here in England. I think the plants and the animals don't know where they're going. Pests are climate sensitive, so we're going to get more of those, and likewise with the infectious diseases. So a huge problem with climate change. So let's go back to our professions. I want to talk about the ups and downs. Now, for the youngsters who are going to start soon, we're just looking forward for you to come into medicine because you are going to take the profession forward. But remember, whatever you do, we will be there to look after you. So when you qualify, you've got a sort of various things you can do. You can either do clinical, in fact, you'll all be doing clinical service with the NHS or outside. You can be a GP, you can be a doctor, you can be a specialist, and so on. But whatever you do, you can be teaching. You'll be teaching the next generation, whatever post you do. And that, to my mind, is the most exciting thing to keep everybody going. But also, I hope you'll all do some research, and some people can actually become academics and just do research. So it's really quite complicated, but whatever you do, you're going to be a leader. And so you've got to really make sure that you know what you're doing, lead by example, make sure you take everybody with you, as otherwise you will not get anywhere. So when you do qualify, and this is for the junior staff who are listening in, you've got a huge amount of work to do, haven't you? You've got ward work, you've got outpatients, but again, as I said, you work in a team. You teach, you've got to carry on your continued professional development, as you just heard the GMC, Chris talk, that in fact, you know, not only do you have to qualify, you then have to revalidate every 5 years. The other things you're also doing, you become a manager and a leader. You've got to appraise everybody, and you've got to be the appraiser, but you also have to be appraised yourself every year, and the revalidation. So really, there's a huge amount of pressures, you know, and where do you fit in your family, your marriage, your other things? And I think, you know, you've got to be able to prioritize, but make sure the family is the most important. And then that's research. So let's just look at the ups and downs, and I just put them into two lists. Now, the ups is very rewarding. Really, medicine is the best career in the world, and I've thoroughly enjoyed it, even at my age. You can care for patients. Obviously, as you're a junior, you climb up the ladder, you pass exams, and you get that. But it's a huge privilege because you can heal the patients. And also, it's a team, and you have wonderful colleagues who can help you in greater problems. And remember, it's great fun. If medicine's not great fun, just don't do it. But there are downsides, and we're there to help. It's hard work, it's long hours, you've got to take lots of examinations. But sometimes the morale gets a bit low if you feel you're not looked after, and the stress, the anxiety, and you become depressed. So just make sure that you look after yourself. I think doctors are so keen on helping others, they forget themselves. And you're trying to be a macho person. Well, you can't be. Or remember that you're also important and need help as well. And this is where the Royal Medical Benevolent Fund comes in, which I'm very pleased and very proud to be president of, being president for 7 years and going to be finishing, I hope, this year. But it's a charity for doctors, medical students, and their families. So we look after you totally. It's been going for a long time, and what we do is to provide support, financial support, money advice, information in times of crisis. And even before you have the crisis, you can phone up or look online for things that you can do to help yourself. So as I said, we help doctors and their families. So if you're, you know, and when I say we help, for example, you're a doctor and you suddenly have an accident, you can't become the family, the person who leads the family. We can now help the families and the doctor as well. So maybe, you know, somebody the other day had a car crash and we helped them with a wheelchair. We also help refugee doctors, and medical students now have come in there. And there are other sources like Doc Health, and which in fact the Royal Medical Benevolent Fund also funds, and the Practitioner Health program, which is now also supported by the NHS. So as Ed said, we need doctors, we need nurses, we need midwives, we need everybody really in the healthcare profession. And the dark areas, again, as you would expect, rather like the heat map I showed you just now, it's other people who really need more and more doctors. We are, and these are a number of doctors, nurses, and midwives per 10 million, but we are 100 million short of healthcare workers. So, you know, if you can help, please do help, because we are not training you to be a doctor in the UK or in any particular country. We're training you to be a doctor of the world. Now, this is something that I was interested in, and I came across some students who were very, very keen on global health. So I said, look, why don't you write the book? And we got 127 medical students from, it's called medicine now, I think it's Doctors for the World, or Medical Students for the World, who now have read the book. So please try and get that. And one of the joys about medicine is that you can go around teaching, helping with the research, and you pass on to the next generation. And here I am, just off a plane, teaching people, I think, in Lusaka. But that's the high point of it. The low point of all my travels was this, where I went to Liberia and went on a ward round. Now, the problem with the students is they're using Western medical textbooks. And, you know, the nearest CT scan may be 100 miles away. So why, you know, if you say somebody's got a tumor, do a CT scan, well, you can't do that. You need the basics to work it out. And here, which I was just horrified was, in the A&E department there, this lady had been brought in the night before. She'd been shot by her husband, and the bullet had gone from one side to the other. So both her pelvis, the pelvis and everything else was fractured. And they put up a sort of Heath Robinson thing here with plaster, with bags of sand over a bottle of water with bags of sand to stretch it. Now, the problem with her, his prognosis was very bad. She needed antibiotics, which funny they had, but she needed a CT scan. She needed operations, which of course she couldn't afford. So she would probably die, but the husband goes free. And this is where the women do not get the right amount of support in the world. And the right to health is a human right. And the health of a nation is really determined by the health of its girls and women. So if you can teach and educate a woman, you will transform a family. If you do a man, it will just be one person. And also women will then do community work and help everybody else. So doctors in society, please, whatever you do, please maintain your integrity, your compassion, and your altruism, which is really why we all do medicine. And of course, we have got to look at ourselves. We've got to continue to improve. We've got to be excellent as far as we can be. We work in partnership with other members in a wider healthcare team. And these will say really the tenets of being a doctor in society, which was put out by the Royal College of Physicians. So in conclusion, you have lots to do, but please do what you want to do. Make sure you get to your dreams. And if you want to dream away. We can help you get there. There's lots to learn, but get the basics right. And the complex stuff you can work out yourself. Now, the other thing is look at other countries, because they have this wonderful innovation with very poor resources. And we can bring that back to the NHS or to more higher income countries. And also, as I said, you will be a doctor of the world. You won't be a doctor just for this country. But everybody, please never lose your enthusiasm. Never be arrogant. Being a doctor is brilliant. It's a real privilege to be a doctor, but don't be arrogant about it. But above all, please have fun. Because if you don't have fun, forget it. Anyway, I hope you've enjoyed that, and it's been thoroughly good to talk to you all. And I wish you all the very best wherever you are, and good luck to you all.